watching WKBN 27 First News, where your news comes first. Now in high definition.
Well, social networking is constantly changing the way that we communicate with each other, including with our doctors.
Social media and technology in general, of course, is changing relationships with health providers, sure to affect healthcare in the future as well. Joining us to talk about all this morning is Dr. Michael Sevilla, who practices family medicine in Salem. Good morning.
Good morning.
You had mentioned to us earlier, it's interesting, there are apps available now, too, that can actually help your health care.
That's right.
And your health. Describe a couple of them.
Well, there's a couple of them. The one that I'm thinking of is that it's something that you can put on your phone, because a lot of my patients, they have smartphones now, and they're tracking their health on it. The app that I'm thinking about is for patients with sugar diabetes, and they can input their blood sugars in there. They take it 3 or 4 times a day, and they have certain goals that they can meet, and if they meet them, they get points. And if they get a certain amount of points, they can download iTunes songs. And it's a huge thing, I think, as a trend for next year. The term is called gamification of your health and of apps. So that's a huge trend for 2012 that I see.
Wow.
You've heard it here first.
Gamification of your health. And I mean, when you think about it, especially with kids with diabetes or young adults, they may be more apt if they've got an incentive to pay attention to what their blood sugar level is 4 times a day, get their points, and collect the prize.
And even adults too. I mean, I have a lot of my patients. They write down or take pictures of what they eat. They put it on their app, and they want their to have reinforcement with that. And there's phones. Everybody has phones now, so it's very common.
And that would work, because I know, like, you can always download an app, but to keep up with it is the tough part, because there are days you miss things, and then it just falls behind. You're just like, well,
when there's a reward, that's when you keep up with it. That's interesting. Now, speaking of maybe constantly being on call or always, I would imagine that if you friend your patients or the patients friend their doctor, there is a temptation to, like, I kind of have a headache this morning.
That's right. That's right.
That you would always be on call. Do you friend patients ever, or are doctors talking about this at all? What they should do?
It's a huge thing with physicians now when it comes to social media and Facebook and Twitter and things. And I want to be clear. I mean, I don't do any kind of medical care on Facebook or Twitter or anything like that. A lot of the people that I friend who are my patients have been longtime friends. I've known them for a long time. But if somebody contacts me and say, hey, I need a refill on my medicine, I direct them back to the office for proper channels and that type of thing.
Right. And as long as you're clear on that, I'm sure you probably could have, I mean, because a lot of people know you and they want to see, especially because you're so active on Facebook and a lot of these social networking sites with blogs and so on for healthcare.
Exactly, yeah. And a lot of physicians ask me, well, why should I even care about this? But I tell them, and I talk to a lot of physician conferences about that, is our patients are going to push us to do this. Every day in my office, I have patients that print up stuff from WebMD or other type of sites and say, is this credible information? Is this good information? And I see that as an opportunity to talk with patients about what is good information on the internet and what is bad information on the internet.
Oh, that's true. So you can sort of nip it in the bud before you have a problem.
Exactly.
All right.
Well, thank you for keeping up on this technology, because a lot of people, it's overwhelming. It moves fast.
Very quickly.
All right. Well, thanks very much, Dr. Sevilla.
Thank you.